My name is Megan Ramos. I'm the Intensive Dietary Management Program Director. I co-founded the program with Dr. Jason Fung 4 years ago. We'll be 4 years old on June 5th, 2017, which is really exciting for us. I was actually Dr. Fung's first guinea pig, so I'm going to take 5 minutes and just share with you a little bit about my own journey. I've worked with Dr. Jason Fung for close to 18 years. It'll be 18 years this upcoming May. I was a student assigned to him when he started practicing nephrology. So he was a fresh new doctor to the clinic, and we work in a nephrology center, which is a kidney disease clinic. And we do a ton of research at this nephrology center. So Dr. Fung is a medical doctor, but he's very keen on doing academic research as well. So most new doctors, when they link up with our nephrology program, are required to do certain research projects to help integrate them into the research component of nephrology within our center. And I was a student assigned to him to help him out with various research projects. So I've worked with him for a very long time. I decided to stick around throughout my education because he's such a nice guy to work for, and we have a really great team. And it's been a real honor to work with him for all these years. But in my mid-20s, I started to get very sick. And thanks to him, he really helped save my life. Looking back at my own health journey over my life, I'm pretty sure I had insulin resistance from the time I was born. I was an over 10-pound baby, fed carbohydrates my whole life. I was always sort of skinny fat, though. I was thin. I was classified as underweight according to my BMI. But I was very weak. Despite being relatively active, I did swimming and figure skating, soccer, basketball. I was very active, but I wasn't very strong. I was 12 years old when I was diagnosed with fatty liver disease. My family doctor wasn't overly concerned about this fatty liver disease because she said, well, you're underweight and you're 12. You'll grow out of it. But that was her attitude. Well, I didn't grow out of it. It sort of stabilized in my teenage years, and it flared up in my mid-20s. I was 14 when I was diagnosed with PCOS, which is polycystic ovarian syndrome. I was diagnosed with that after being rushed to emergency one night when I had a large cyst rupture, and I was convinced I was dying. Something terrible was going on with me on the inside. And they did an ultrasound there and diagnosed me with polycystic ovarian syndrome. And when I went to my family doctor, oh, you're young, you're underweight, you'll grow out of it. That was her whole mentality. Well, I never grew out of it. I struggled with polycystic ovarian syndrome and the symptoms of polycystic ovarian syndrome throughout my teenage years, despite still being underweight. Came my early 20s. I was a student. Didn't eat well, but didn't eat often. So I was actually one of my few friends that was able to maintain my weight throughout my academic studies. In hindsight, I look back now and realize I was intermittent fasting all of the time. There were so many nights where 11 o'clock would roll around and I wouldn't know if I had eaten or if I had not eaten that day. So I did have your typical college diet of pizza and fast food, but it just was very sporadic. I was hyper focused on my studies, and different kinds of stress induced eating in me, but academic stress never really induced hunger cravings in me. I was just hyper focused. So I came out of university unscathed. But when it was time to enter more of the workforce, that's when I really started gaining weight. I started eating a lot more. I had my evenings free again. So I would come home. I caught up on about 7 years worth of television that I had missed throughout school. And particularly living in a seasonal climate like in the Toronto area in the wintertime, you don't want to go out too much. You're not walking the dog around the neighborhood for an extra hour. You're just taking him down the street and hoping that's enough and he can get the rest of his exercise in the backyard. So I started to pack on the pounds, and they all fell on my midsection. So as someone in their mid-20s, I was very conscientious about this, particularly having been so thin my whole life. I went on a severe calorie-restricted diet. I lost a little bit of weight at first. My weight loss stopped, and then I started gaining more weight back. I ended up gaining back more weight than I had lost. I started working out with a trainer. She was fantastic. She has a mother of four and a body that I think most 22-year-olds would kill for. And I started working out with her, thinking she must know what she's doing, and she can get me to look like that. She worked really hard with me. I paid her an arm and a leg to work really hard with me, but it didn't. Nothing happened. I put on a little bit of muscle, but nothing really happened. It didn't help me lose weight. And I got really frustrated. I went to see a fancy dietitian downtown in the city of Toronto, and I tracked all my meals for her. Information is key. Data is key. So I tracked all my information. I gave her all my meal plans, my exercise regimens, my calories in, my calories out. I gave her all my blood work showing that I had normal thyroid function, but I had fatty liver disease. And she just sort of looked at me and accused me of lying to her.
Not yours, it's ours.
Plan. And accused me of saying, oh, there's no way that you're eating like this. And you're not losing weight unless you have a thyroid problem. So I became really disheartened. I stopped going to see her because she just accused me of lying to her. And it was just really frustrating. So I had gained 60 pounds in about a year span, all in my midsection, pretty much. And I went for my annual physical with my doctor, and I asked her to do even more blood work, and everything was normal, but my hemoglobin A1C. So your hemoglobin A1C is sort of the biomarker in your blood that they use to determine whether or not you're at risk for diabetes, or you are diabetic, or you require an oral glucose tolerance test to see if there is some diabetic issues going on. So a hemoglobin A1C measures how much sugar is hanging out on your red blood cells over a 120-day period. Red blood cells have a lifespan of a 120-day period. A hemoglobin A1C level of 5.5 or less is normal. A hemoglobin A1C level of 5.5 to 5.9 is considered borderline. And a hemoglobin A1C, a hemoglobin A1C of 5.5 to 5.9 indicates that you are at risk for diabetes. A hemoglobin A1C of 6 to 6.4 is borderline diabetes, and 6.5 and higher is you're labeled as diabetic. So again, normal is below 5.5, about 4.5 and 5.5. At risk is 5.5 to 5.9. Borderline is 6 to 6.4, and diabetes is 6.5 or higher. So I went to see my doctor, and she told me my hemoglobin A1C was 6.4%. And I just broke down crying in her office. To me, diabetes was a death sentence. All I had done was watch people die from diabetes since I had started working in nephrology and doing clinical research. So I'm a clinical researcher by trade, and I would monitor people's progression of their kidney disease, just so I could see if there was any better indicators for detecting kidney disease earlier on, any other correlations that might be worthwhile doing more intensive research on. And all I did was watch people die from diabetes. Diabetes is one of the primary causes of kidney disease. So as my patients' diabetes got worse, their kidney disease got worse, and there was nothing that the kidney doctors could do to help the kidneys if the diabetes was getting worse. So all we had was bad news for patients all of the time. I watched patients have their toes auto-amputate, their legs get amputated, the chronic infections, the nerve damage, the protein in the urine, the kidneys completely failing. The transplant wait list is like eight years in Ontario. And I watched people develop early Alzheimer's and dementia from the diabetes. I watched women struggle with fertility issues because of their diabetes, and I just broke down crying. I've had cancerous cells that I've beat. I've had 16 and a half hours of heart surgery to fix a birth defect that I was born with in my lifetime. And finding out about that birth defect and finding out about those cancerous cells, to me, there is a way to beat them. There is a way to beat those cancerous cells at the stage that they were caught. There is a way to fix that heart defect that I was born with, even though it required 16 and a half hours of unpleasant surgery that I had to be awake for. There was a way to fix it. After 16 and a half hours, I could be fixed. There was no way to fix the diabetes. So to me, my doctor, when she handed me my lab test results, was handing me a death sentence. And I just broke down crying. What was I going to do? What kind of life was I going to have? I was 26 and a half at the time. And was I going to be able to have kids? Was I going to have dementia by the time I was 40? What was going to happen to me? So I went and I talked to Dr. Fung about this. We had worked very closely over the years, and he had told me that he had been doing a lot of research into intermittent fasting. But he said when he had brought it up with other colleagues of his, they all thought, oh, he's quack, like he's lost his mind. Here, Dr. Fung goes again with some crazy idea. So I said, I'm not really talking about it much because nobody's really taking me seriously. But he's like, think about most major religions in the world. And he's like, talk to your grandmother. He knew my grandmother was Catholic. He says, ask her. What was Lent really like when she was growing up? So I did. I talked to my grandmother, and my grandmother said, it was about fasting. Fridays weren't no meat. They were fasting days. Things were very different when she was growing up. Most major religions in the world all implement some kind of fasting to help you detox, to help give your body a chance to rest and re-heal and reset. I think Greek Orthodox fast the most. I think they fast close to about 200 days of the year historically. It used to be true fasting. Now I know it's not so much true fasting as it is anything else. But it used to be pure fasting. Lent used to be fasting. My best friend growing up was Hindu, and she would fast for 24 hours twice a week, even from childhood. So fasting is used in a lot of major religions. Muslims, Ramadan, they fast for 30 days. They fast between sunrise and sunset for 30 days every year. Fasting has been a big part of our evolution as a species. So Dr. Fung started talking to me about fasting, and he started talking to me about my diet. What did I eat? Well, I ate a low-fat diet. And he said, well, low-fat diets are very high in carbohydrates. And when I actually broke down the number of carbohydrates I was consuming around 150 grams a day, which is the recommended guidelines for those who are diabetic, is 150 grams of carbs a day. So he said, the carbohydrates, they cause insulin secretion, and insulin secretion causes weight gain, and all of these things we're going to discuss today in this first half of the session. So Dr. Fung's like, think about it. I mean, you're a physiology girl. Think about this. And I went home that night and I thought about everything I learned in school, and I thought about my diet. My diet didn't make sense based on everything I learned in school. Carbohydrates cause insulin secretion. Insulin secretion traps fat if your body doesn't need the carbohydrates to fuel it. So I went home and I just felt so distraught about everything I had been doing to my body. At this point, it had become self-inflicted. No wonder why I wasn't losing weight. So the next day, I chatted with Dr. Fung, and I agreed to give the fasting a go. I started off with the fasting pretty slowly, and I worked my way up to doing some longer fasts. I started doing 3 24-hour fasts a week, and I did that for about 6 to 8 weeks. And then I moved up to doing 2 42-hour fasts a week and 1 24-hour fast a week, and I stuck at that regimen for quite some time. Within 6 months, I lost 60 pounds. Within 6 months, I brought my A1C down to 4.6%. And I also no longer had fatty liver disease. And the PCOS has seemed to resolve itself according to my ultrasound and also just my regularity. And my hormone levels that were checked on blood work. Everything was going really well. So it's been about 4.5 years now since I initially lost the 60 pounds and brought my sugars down. I had my blood work done last week, actually. My hemoglobin A1C is 4.5%. Not only have I been able to maintain my 60-pound weight loss, I'm now down 80 pounds in total, which has been pretty cool. I also discovered a couple of years ago that I had osteoporosis. I can thank that to all the phosphoric acid that was in my diet from all of the diet sodas and diet pops that I drank growing up. I used to be a diet soda junkie. I probably drank between 12 and 18 cans a day until I got the cancer diagnosis, and I quit then because I was scared of the aspartame. So all that phosphoric acid ate away at my bones. So I started doing a little bit longer fast over the last year to help increase my bone mass density. So now I have borderline osteopenia. So I'm hoping by the end of 2017, I won't have osteopenia and I'll have normal bone mass density for someone my age. I'm 32 and a half now. So I've had quite the journey myself. Dr. Fung and I, at first we weren't really allowed to do this with patients. But my patients saw how well I was doing, and they said, we don't care what it is that you're doing. And I started sharing with them a little bit about how I was fasting, and I encouraged them to go talk to their kidney specialist once they were done with their check-in with me. And they would go, and eventually our kidney team said, let's try this on a few patients and let's see what happens. And we were able to get all of those patients off of their insulin and their other diabetic medications. And now our program has sort of snowballed. It has really snowballed over the last year since Dr. Fung's books have come out. We've been trying to spread the word. We launched the long distance program about 2 years ago. A lot of people in the United States in particular are reaching out to Dr. Fung, asking for help, willing to come to Toronto. For legal reasons, he can't treat patients who live outside of the province of Ontario in Canada for his own medical licensing reasons. And he actually did one of his residencies at Cedars-Sinai Hospital in Los Angeles. So he's very familiar with the healthcare system and the insurance, health insurance plans down there. In Canada, particularly in Ontario, our patients are exceptionally fortunate. In most circumstances, our government covers everything. We have public health care. But Dr. Fung, he felt bad for these American patients who were reaching out to him via email and who just didn't have health insurance and were paying 3 times the cost for their insulin than when insulin costs in Canada. And they just couldn't afford these medications. So we started doing the long distance program. I am not regulated like Dr. Fung is regulated by the Ontario College of Physicians and Surgeons. So I am able to do this long distance program with our long distance participants. I also see all of our inpatients with Dr. Fung. Dr. Fung and I have been working closely together with the IDM program in our office for the last 4 years now. And I do all of the fasting coaching and education for all of our patients. And Dr. Fung reviews their lab work and he adjusts their medication. So that's how the long distance program differs from our in-office program. This past summer, we just got very busy. Our wait list for our in-office program grew to 18 months. By 18 months, some people can be very, very sick, and we don't want it to get to that point. So we recruited Nadia to join us to help us with some weight loss patients and patients who are diabetic but are not on insulin. So she works with a couple of other doctors in our program to help them adjust patients' medication. So Dr. Fung and I are currently focusing on our in-office patients with insulin. So those are the only patients that we're taking on in clinic right now. We're also have been given a lot of patients with early Parkinson's disease, early MS, early Alzheimer's disease, and cancer that we're trying to work with in the office too, to learn a little bit more about how fasting can affect those conditions and how it can hopefully benefit those conditions. So we're working really closely together to try to see what more we can do with the fasting aside from metabolic syndrome and weight loss. So that's a little tidbit about how the program manifested and how us skinny guys got into the program. I know it's not easy. I've done it myself. It is a really big struggle. Like I said earlier, there's some stresses that cause me not to want to eat, and there's some stresses that cause me to eat. I know a lot about stress eating. I know a lot about carbohydrate addiction. I am a carbohydrate addict through and through. I had no idea what an addict I was till I tried to cut those out of my diet. I also grew up with a father who is a carbohydrate addict, and he actually moved out on his own away from my mother about 4 years ago to try to get control of his diet. Because he couldn't live in a house with other people who weren't eating the same way as him, because his weight was just going crazy. My father is a trial lawyer, and when he is in a trial, he would actively gain a whole bunch of weight, and he would try to lose it again in between trials. But he lost a brother at 36 from heart disease. His younger brother, who is in extremely good shape, has had a couple of heart attacks in his mid-40s. My father lost his father very young to heart disease. His mother, all kinds, multiple heart attacks, strokes, transischemic attacks, aortic aneurysm. Heart disease has plagued both sides of my family. But because my father's carbohydrate addiction and food addiction was so strong, he actually removed himself from the family home throughout the week so he could try to better his diet and not be tempted. So I know what a real struggle this can be for people. I've definitely lived with the extreme end of it growing up. And throughout my childhood, I've been able to work some strategies in for myself and lots of other patients to help deal with the carbohydrate addiction and the stress eating, and hopefully we can work together and help you. So we'll get started talking about today's session. Today we're going to talk about the purpose of the program, obesity, diabetes, insulin resistance. Then we're going to take a break, and then we're going to talk about how the program works. Then we're going to take another break, and then we're going to talk about meal timing and the food guidelines. In this program, the majority of the patients in this program are looking to lose some degree of weight, whether it's that last 10 pounds that they haven't been able to lose on their own through a low carbohydrate diet and doing a little bit of fasting, to patients who are looking to lose about 250 pounds even in the program. We've had well over a dozen patients lose over the 100-pound mark, which is really exciting. The most one patient has lost to date so far is 178 pounds. The quickest somebody has lost 100 pounds is a patient named Mark. He appeared on one of our Fasting Talk podcasts. He lost 110 pounds over a 4-month period. So that was sort of the quickest 100-pound weight loss by far. But we've had quite a handful of patients lose 100 pounds within one calendar year, but they work very hard. So we treat the full spectrum of weight loss. We also treat the full spectrum of diabetes. We have patients who reach out to us because their hemoglobin A1C is heading towards that 6% range, and they're heading towards that borderline diabetic range, and they don't want to be in that range. And on the flip side, we have diabetics that come to us on 350, 650 units of insulin, plus 4 oral diabetic pills with A1Cs greater than 15. So we treat the full spectrum of type 2 diabetes. We also treat a lot of fatty liver disease. Fatty liver disease is just diabetes of the liver. It's not always caused by alcohol. Years and years and years ago, fatty liver disease was pretty much only caused by excess alcohol consumption. Nowadays, it's caused a lot by excess fructose consumption. So when patients come into the clinic and they say that they have fatty liver disease, or I tell them that they have fatty liver disease, or Dr. Fung, they get embarrassed and they say, well, we don't really drink that much, a glass of wine here or there. And I'll say, no, but did you drink a lot of orange juice or apple juice or grape juice? Did you eat a lot of fruit? Did you eat a lot of candy? Because a lot of candy is made from high fructose corn syrup. Those sorts of things. And did you drink a lot of sodas? And those sort of drinks. And most often the answer is yes, particularly in North America. Every time I walk down the street, my tummy turns because I see all these children guzzling on their big cans and bottles of soda, left, right, and center, and their supersized bottles or cups of soda from fast food restaurants. And that is the big contributor of fatty liver disease. We also treat a lot of polycystic ovarian patients. So a lot of patients get referred to our program to help treat their polycystic ovarian syndrome, to help them with fertility. Most women come in and think that they're doing this program to lose weight. But what a lot of people don't realize is that polycystic ovarian syndrome is just diabetes of the ovaries. Alzheimer's disease, I'm sure many of you have heard nowadays, is they call it diabetes type 3, where it's just diabetes of the brain. Now, there is a strong genetic component, and there's definitely there are some Alzheimer's cases, a lot of Alzheimer's cases too, that occur without diabetes playing a role, or diabetes playing a role whatsoever. But nowadays, we're seeing such a skyrocket in Alzheimer's disease because it is related to the diabetes. So it's just essentially diabetes of the brain, and many of the newer cases that we're seeing over the last 10 years. So we treat a lot of these conditions in our clinic. We've been working with several cancer patients in conjunction with their naturopathic specialists and their oncology specialists. We're big about integrative medicine here, and everybody needs to work together. We've been working closely with a Canadian neurologist working in New Zealand, helping out his patients with a variety of neurological conditions, namely Parkinson's disease, just to see if the fasting and the diet is helping with them. And so far, so good. But we've just started working out with these patients over the last 6 months. And so far, so good. Their test results, everything is looking promising. But we don't know what the long-term outcomes of those patients will be. We also have a lot of patients who just reach out to us and say, we want to live forever. We're perfectly healthy right now, but our parents' health wasn't good or isn't good, and our grandparents had poor health, and we want to live really long, healthy lives. Can we do this program too? Absolutely. I met my husband after I had lost my weight and I had reversed my diabetes. My husband's 5 years younger than me, and he's always a pretty healthy guy. And he said, can I do this along with you so I can prevent this disease? He said, oh, my grandparents were diabetic. They all had Alzheimer's disease from their diabetes. And he's like, I don't want to be like them. Can I eat the way that you do? And can I fast along with you? And the answer is absolutely yes. Of course, we always want our patients to be medically supervised if they're fasting. But he was definitely going to be having supervision, but he just wanted to prevent disease. And to look at him, he's 6'5". My husband's a giant. I don't know if you follow me on social media, but I'm 5'1", and I married this giant 6'5" guy. And we had a whirlwind romance. We've been together for 2.5 years. We got married 1.5 years ago, roughly. And he's down 70 pounds from when we first started dating over the 2.5 years ago. I don't know where the weight came from. He looked pretty great to start with, or he definitely attracted me off the get-go. But he's lost the weight. He's really improved his body composition overall. Now he's actively trying to put on some good muscle weight, and he's feeling more energetic. He's getting better sleep. Life has improved a lot for him, and he didn't realize that he had such a poor body composition before. So pretty much most people can do this program for disease prevention as well.